A very warm welcome to our session today. Um, this is the fifth in our series of webinars that we've been conducting over the past several months, and we have gone deep dive into a number of topics. And today we have deep dive into our pharma and healthcare sector, where we'll talk about some of the work that we've done in the sector, some of the solutions that we have developed, and more importantly, how Microsoft Dynamics 365 as an ERP solution helps pharma and healthcare sector with their technology requirements. Before we get started, we'll just give a couple more minutes. I know we have a number of people trickling in. So we'll just give another minute or so, and then we can get on with the agenda for today. Yeah, I think we can get started. We have a number of participants joined in already. Again, welcome everyone. Thank you for joining in for this session today on Pharma 365, our solution for the pharmacy and pharmacy distribution and retail sector, which is built on top of Microsoft Dynamics 365. This is the agenda for today. We'll do a quick introduction about ourselves and our experience, our view on how we see technology landscape and the technology requirements in the healthcare space. And we'll do a quick introduction on Microsoft Dynamics 365, the solution, look at how comprehensive the solution is and how it helps on the various facets of an organization's technology requirement. And then we delve into the details of the healthcare and pharmacy sector, where we talk about different solutions, different operational challenges that pharma companies face, and how technology can help resolve or be more proactive in handling some of the dynamic requirements that keep coming in the healthcare space. So about the solution consulting, we are a Microsoft Dynamics Gold implementation partner. We are headquartered in Dubai with offices in Saudi Arabia and India. We are an end-to-end solution provider from consulting to implementation, integration, customization, and analytics and maintenance solutions, and across the entire spectrum of Microsoft's suite of solutions, ERP solutions, right, from finance, supply chain, CRM, HR, and then you have the wonderful analytics and dashboarding solution in terms of the Power Platform from Microsoft. We are roughly 130 members strong, delivered over 100 plus projects with more than 50 end-to-end ERP implementations. We are focused on the retail, healthcare, manufacturing, financial services, energy, and real estate industries. These are sectors we have significant experience in. And in terms of our approach, we keep it very simple. ERP implementation is a journey that an organization as well as the partner takes takes together, and that is where our aim is to build partnership with organizations so that we go through this journey together and not just see it as a technology implementation, but as a transformation for the organization itself. These are some of the past sessions that we've done. These sessions are available on our website. You can go to our website and go through these sessions. We started off with a overall Microsoft Dynamics 365 overview session, and then did some deep dives into finance, supply chain, and project operations. And this is the fifth in the series where we do a deep dive into the healthcare and pharma vertical and look at some of the technology solutions that are available for organizations. Now, from a technology perspective, this is how we see, based on our experience across various organizations in the healthcare spectrum. Healthcare is a highly regulated, very dynamic industry. The ecosystem is huge. You have health authorities, you have government departments, insurance companies, pharmaceutical manufacturers, medical device manufacturers, pharmacy retailers, medical professionals, and then your customers, your patients. All of this as an ecosystem has various stakeholders. And then when you look at these stakeholders along with the operational complexities with various services that these healthcare organizations offer, the whole revenue cycle management, right from patient coming into uh, your organization to realizing the revenue from the payers, your managing of the health records for patients, a number of regulatory requirements coming in, the most recent one being serialization that's been coming, and then the whole reporting requirement that are needed for these organizations who are based in healthcare. If you look at all of these things, I think there are a number of moving parts. There are a number of things that are very dynamic in nature and keep coming in very frequently. It is imperative for healthcare organizations to have a strong technology backbone to help manage all of these things. And that is where your back office function, your front end with your hospital information system, your patient information system, your distribution of different um, medical devices, pharmaceuticals, and then you have the ultimate retailing of um, these products and services. All of this needs to be managed effectively with a technology solution, and that's the core of this session today. These are some of our clients that we've worked with, especially in the Middle East region. And as we go through the session, my colleagues, Sajid Abdulaziz and Satish Manoharan, they come from rich background in the retail healthcare space, and they'll be talking about some of these experiences with these clients, as well as solutions that we have for these organizations. Um, Quickly, digital transformation, we don't see digital transformation as a tech transformation. Tech is a very small component of the overall digital transformation. Your infrastructure upgrade, your application upgrade is probably 30% of digital transformation. The real transformation happens when you use these technology and infrastructure solutions to transform your business and transform the culture within the organization. And when I say culture, your employees, your partners, your suppliers, your customers, when you enable all of these with the technology solution and leverage the data that you nurture across all of these stakeholders and use this data to be more proactive and prepared for changes in the industry, disruptions in the industry, that is where you actually um, you know the true digital transformation happens for an organization. And that is how we approach digital transformation. We not only are a provider of the technology solution, but also an enabler in your business model transformation as well as the cultural transformation. And so that's how we look at digital transformation. And now I would like to transition to my colleagues, Sajir and Satish, so that they can talk more in terms of D365 as a solution, as well as the different solutions that we have for the pharmacy and healthcare businesses.
Anish,
Before
just
we get into the next session, there is a quick poll. We just want to look at the organizations that you come from, so that we understand the profile of the participants today, and it'll just help us navigate the session better, and also cater to the specific requirements of the people that we have today. Thank you so much again for joining in, and hope you have a wonderful session. And we look forward to active engagement. Thank you so much.
Anish, we have received close to 23 responses at this point, and majority of them are from pharmacy distribution and retail and hospital and clinics. There is a segment which caters to other healthcare services as well, and uh, the least ones are coming from pharma manufacturing.
Okay, great. Great. I think we can get started on the next session. Please do share your questions in the chat window as you go through the presentation and demo. We'll take it up as we go through the session. Over to you,
Hi, hi.
Sajir.
Yeah. Thank you, Anish. Thanks for the wonderful presentation and greetings from TSC on all the participants. My name is Sajir. I'm a principal consultant of the Solution Consulting. So I know like that there are a lot of people who are familiar with Microsoft Dynamics and Microsoft related products as well. So when we talk about Microsoft Dynamics as a solution, it's not today, it's only an ERP. It's together which caters the entire aspect of your collaboration, your data capture, then in the presentation layer as well. Along with Microsoft OpenAI technologies in terms of the cloud, security, compliance, and everything which is coming under one platform. That is where Microsoft solutions ensures like that you as a customer is getting a true digitalization experience while you are moving into the operational or ERP implementation process aspect is concerned. So the productivity and collaboration completely enabling the customers and the participants, the customers, partners, along with the providers, government authorities, and everybody who is coming into the ecosystem, they will be able to collaborate together over the space which it is available. It can be in form of teams. It will be able to talk with your operational application like finance, supply chain, marketing, and everything. There is then Power Platform related components are available for you to get the transformation much more faster. So it enables not in terms of as a technology provider for from our side, it enables even the customers even to enhance the digitalization experience what it got created initially by the partner ecosystem. So to talk about Microsoft Dynamics, it contains the entire aspect of an ERP. It's not only talking about the retail pharma, but it contains end-to-end operational cycle, your finance, your supply chain, your human resource payroll, your commerce, then the project management, manufacturing, whatever industry which you look in, that will come under one solution, and a partner will be able to configure that according to the customer requirement completely. So it's coming from a global, adaptive, insightful perspective by saying like that, okay, this particular product can be adopted by any of the industries and operational institutions available across the globe in a large scale, medium scale, or a small scale. They should be able to utilize the solution for running their day-to-day operation aspect is concerned. So it's not, it help you to connect with the entire departmental participants like finance, supply chain, your operational team, your HR, IT. Everybody will be able to use the single solution for getting their things done much more faster in a predictive manner. That's where the major important comes. So the major important things in one platform, it's very unified and it contains many applications which along with the 64,000 global partners is available. That means you will never left alone whenever you have a requirement in terms of your solution aspect is concerned. So you should be able to get the solution from the furnished applications. LinkedIn is connected, Office 365 is connected with that one. Then the large ecosystem of partner along with the Microsoft Azure cloud ensures like that your digitalization journey is completely enabled in every aspect is concerned. The good thing about D365 is completely mobile and web ready. That means the approval application, the timesheet booking, the expense tracking application, patient booking, all these things you should be able to do through the mobile application suites available from different data. And the entire data, whatever it is created by the entire platform is unified and stored in a single place, though every application and the stakeholders will be able to utilize the data. When we talk about Microsoft Dynamics 365, it's all about a set of this many applications. Today, we will be focusing largely on the commerce. The commerce is the retail point of sale, the selling items, its information, promotion, discount, customer loyalty, then the customer engagement, their cart. This everything comes under the commerce. But when you talk about the supply chain management, talks about your inventory visibility, your batch tracking capability, your serial reporting capability, everything will be coming under supply chain as well as. Obviously, finance contains the APAR, GL, everything required. And the best thing out of it is this is not an integrated application suite, but it's a single solution. So it doesn't need to worry about the data transformation, integration, pushing, pulling data, nothing it's there because it's a single solution available for the customer to do their requirement. And the customer will be able to pick and choose based on their own requirement. Consider you are running your own an HIS solution. The HIS operation completely will be able to handle inside the HIS. But most of the HIS system in this world is very poor in terms of handling the inventory management, the product information management, as well as the financial reporting along with the HR capabilities aspect is concerned. So that's where it's important. You need to have a very strong ERP application in backend, which is seamlessly connected with the HIS system to ensure like that the revenue and the transactions, inventory consumption, everything got recorded into the application aspect is concerned. So Microsoft provide multiple tools for getting this journey getting created in a much more fruitful manner. Let us say like that, I just want to create a customer coming into my clinic immediately to be created as a customer inside my ERP system for recognizing the revenue and everything. I should be able to publish an API. The API can be published within seconds and the other application will be able to consume it. This way we can ensure like that there is a seamless integration which we created by ensuring a partition in terms of operation aspect is concerned, because a patient journey, a clinical journey, those kind of stuffs probably Cerner or any such HIS related system will be able to do much more better than Dynamics. But obviously the other portion you should be able to give to Dynamics for better control, especially inventory management related everything. You should be able to use the finance and operation. So you're not limited to over here. We should be able to start implementing. Excuse me. Yeah, we should be able to start implementing the finance, let us say human resource. Then we say we need to create a marketing automation solution which it is required. We need to understand what is the behavior of the customer. Based on the behavior of customer, what they are buying, we should be able to start sending optimal communications to them in terms of profile them, understand what is the surveys which they have received. If they didn't visit us in last 6 months, we should send some offers or some information. A new doctor joins, it's related with this disease or wherever things, everything you can connect. Then the marketing and insights will help you to connect with this data and start sending automated emails, communication, information sending, inviting them for joining different webinars, seminars, and every aspect is concerned. You should be able to do it. So that's what I'm trying to tell. It's not limited in terms of one set of application, but you can start implementing some set of solution out of it. Then you can enhance your requirement completely inside the application suite aspect is concerned. So these are few of our clients. It's not only all related to um, uh, uh, healthcare, but it's related to all manufacturing, government organization, banks, financial institution, different money exchange providers, technology solution provider. There are set of customers which TSC code. That's where our immense rich experience comes in terms of the consulting background, where we should be able to help the customer with mapping the solution wherever it is required for them. So I'm moving into the pharma vertical, especially if you have any specific questions till now that I'm willing to answer, then I'll be able to move forward. Anshul, I'm waiting for the poll or
Yes, Sajid, I've already launched the poll 5 minutes back. We have got responses. The people who have not responded to the poll, please do respond. I'll just tell you the results. More than 50% are already knowing about Dynamics, and they are looking to implement. 25% of them are looking to implement, and um, around 30% have already implemented certain modules of Dynamics. So
that's great. Okay, so the results are in, so we should be able to move forward. I hope if you provide these polls, that will help us to classify the subjects wherever it is coming. If there are some additional information to be shared in terms of D365, please let me know. Otherwise, I will continue into the very broad section in terms of the application where we are focusing into the pharma point of sale and commerce, how that's going to cater for the business. Okay. So from this, when we talk about pharmacies operations as well as the regular retail operation, there is cash and carry operation or brick and mortar related to order management and every aspect is concerned. The pharmacies having little specific requirements, they should be able to capture the customer data. Then there are regulatory compliance related stuffs coming like insurance agent authorities will be coming. Then they would start printing a dosage label for the customer. A reminder should be sent to the customer whenever there is a critical illness medicine. If a customer buys a refill reminder, you should be able to send like that many requirements, which is very specific to the pharma vertical, which you should be able to completely handle it using D365. So what TSC has done, we just little customized the D365 out of the box commerce application to enhance that in a way to accommodate the pharma related requirement aspect is concerned. So it's having the entire dosage printer in UAE. There is Emirates reader. Then you have the EFT integration. Then if you have multiple like that, the queue busting related requirements, everything you should be able to handle using the single solution. Then for pharmacist as well, you should be able to control using the role base. There are OTC sales, there are control medicine sales and everything. Then based on the qualification and restrictions, what you put inside the application, the system will automatically identify the user. Then return management completely configurable. You should be able to put up the controls inside system, what product can be returned, what is the conditions for that, everything you should be able to control. Then the complete inventory management, you have the granular level multi-unit capabilities. Then real-time stock visibility across network. That means a customer coming into one store, if the product is not available, you should be able to check in system by checking whether the stock is available in any other store. If it's available, then in real time, you can ask them to transfer that into your store. You can say like that, okay, I will home deliver this one, or there will be customer will go and pick up from there. All these set of things which is required for the customer satisfaction, you should be able to completely do from the single application, single click. You can completely do that one. So it's fully integrated with your insurance masters, your account receivable, payable, customer and loyalty management every. Then you can see the complete health profile records of the customer, what they are buying, how frequent they are buying, all these details which you should be able to see. Then the full insurance management capability as well, which it got created, starting from the delivering, dispensing the medicine, then getting approval from insurance, then submitting this particular transaction for the ERA approval, then the ERA money which you received, then how much of rejection got happened. There are multiple dashboards as well, which is available from the system, which will ensure like that the complete cycle management from dispensing to your complete settlement with the insurance provider is completely done inside the application. Then in terms of promotions related, because obviously healthcare not only talking about medicine, but it contains vitamins, supplements related everything. You can run multiple promotions, very extensive set of promotion in D365. It contains limitless possibilities for you to create the market-driven promotion requirement completely inside the application. So another, it can interface with multiple solutions. That means in a clinic can integrate the ERS prescription, everything for a clinic can integrate with the point of sale, or you can even integrate that with the multiple clinic providers. Let us say you are running independent pharmacies, but you want to get the prescription records from nearby clinic systems, then you can ask them to integrate with you. Then you should be able to cater their customers in a much more better manner, rather than the customer coming waiting in a queue for collecting the medicines. You can offer them any clinics you are ordering. You will immediately get the product getting ready, packed over there. When the customer walking away from clinic to reach the pharmacy, you should be able to complete the transaction from the point of sale fully in a controlled manner. So I'm just moving into the application. When you look into D365, when you look into D365, D365 is contains the entire module. Let us say there is account payable, account receivable, your asset management, everything is available, along with the insurance, inventory management, your master planning. I'm talking only about the related records of the pharma supply chain aspect is concerned. Then you can have the complete sales and marketing function, retail and commerce function as well. It's pretty rich in terms of its functionality aspect is concerned, but you should be able to start configuring what is required for you. From there, you can start creating the product. So to talk about this one, we will be able to see there is some specific module which you have created for catering the Middle East insurance market. You should be able to keep the entire records of the TPA insurance company, network masters, then the entire store empanelment process, the denial code, exclusion, inclusion list, everything which you can configure inside the system. Then accordingly, the integration can get derived, and you should be able to get it done as part of the system. So you can completely configure end-to-end inside the application for getting your transactions done. Then we have enhanced even the application such as sense to cater the pharma related product information as well. Here you can create your own categories. You can say, okay, my product are categorized in say like that non-pharma aesthetic consignments, then I can further classify it. Then n number of classifications are possible as part of this one. What is the importance of this classification? You should be able to generate your report. You will be able to run your promotions. Then you can easily search and find the product, everything over there as well. When I select a particular this category, when I look into one of the product, you should be able to see there are all the medicines product which it is over there. Then the rich set of information which it is there. I'm showing you one product. This particular product, you can see there is an extensive screen available, which is customized into to accommodate the pharma requirement. It's an activity type tag, whether this particular product is OTC or prescribed, then you can define it. Then accordingly, there will be additional controls and set which will be coming inside the application to say like that. So chronic medicines where it's perishable, what is the storage code? It's a central purchased or a local purchased item. That means in pharma, in Middle East, there is a regulatory compliance like that. All the controlled medicine should be purchased from the pharmacy level, the unit level, then you should be able to do that one. Then you can put up the control. Then the ingredients of this particular medicines as well, you can put it over there. When you put up these details in the system, then system will help you to search and find the product related with the ingredients rather than the product details as well. Then a rich set of additional information you can keep inside the medicine. If you're integrating with a third-party HIS system, then you can keep the HIS related code details, its type, branding, the other details, everything which you can, whether it's a nurse order, yes, for doctor order, all these details, it's antibiotic, is it's consumable. We can keep the entire product information management record from the application itself. That will ensure like that you have the entire controls which it is related with the pharma industry is done. Rest everything which it is related with a product which is rich set available like that for a purchase. I need to have hundreds of control, whether it's what is the price, what is the quantity. Then in my sales process, what will happen? Then my here I'm specifying my default selling unit is a box. That doesn't mean I can only sell it in box. When I can keep a rich unit conversion over the system, I say like that, okay, one box contains 10 pieces. Then even if I have multiple units, I can create multiple units over there by saying a pack contains 2 boxes. What is the price of the pack? What is the price of the box? Everything you should be able to handle inside the system aspect is concerned. So D365 completely handle in terms of your inventory management. When you look into, it will be able to completely handle whether it's a batch controlled item, then what are the batch properties of the item, what is the counting group, whether it's a batch number group which it is there, what is the measurement details which will help you in terms of your warehouse management and related details when it comes. This entire details you can keep inside the application there. You ensures like that your system is capable of handling the end-to-end requirement in terms of the pharma related products for batch control, multiple batch control related every aspect. It will be able to find the details over there. Then multiple product translations you can keep over there. This product translations will help you in such a way like that. Okay, I can keep one product with multiple languages in different countries if I'm operating, or if in a particular community as well, if you have multiple customer requirement to print the product name, prescription details, everything into different languages, you should be able to get it done. Then the batch tracking is pretty important in terms of you should be able to keep the entire product by batch number. The honor dimension is little different, but today, even if you want to control the serial number tracking as well, you should be able to control your product. Then you look into the rich this particular inventory policies. You can define completely the inventory policies, which is pretty important in terms of the batch control of this product. You should be able to say like that, okay, it's a first in first out date control, a FIFO date control, or a consolidation requirement is there if on particular uh, customer in a distribution business says like that, I want every product in one batch. I don't want a mix of batch which it is coming. Then you should be able to have all these particular requirement which you should be able to capture here. Same batch selection is there, consolidated requirement is there. Then for quality purpose, if you want quarantine management in terms of receiving the product, you just want to control certain products like that while it's receiving, the temperature controls are verified and people are recording that inside system. That means as part of while you are receiving the product, you should be able to enable a quality order. Then the quality order can be filled by the team who is receiving that one. In that way, you can ensure like that, okay, my entire procedure in terms of my receiving process is completely handled as part of the application. So I'm talking on product, then D365 contains a pretty large capability. I have shown you the categorization capability. The categorization capability ensures like that you have the entire product. You will be able to keep this product in terms of multiple categories. Then release products by category, which you should be able to say like that I can categorize my product in pharma this way. Then even I want to have a dental product, laboratory product, medical consumables, everything I can categorize accordingly. Then that ensures like that the rich set of product categorization is done. It's not limited over there. In system, it allows you to have multiple categories if it's required. And a brand-wise discount category, if Vitabotics, one particular category which I want to do that one, then everything you should be able to get it created according to your requirement. So it's not limiting to one categorization. You should be able to move into multiple categorization wherever it's pretty important for you to report or to understand your movement of products and things. Then product attributes is a rich set of functions available in terms of D365. So I'm selecting one of the product. Then this particular product, there are product attributes which you should be able to define. That means I want to define certain set of information which is pretty important for me to communicate with my healthcare professionals, like that the doctors or uh, the pharmacist who is distributing these medicines, which in terms of what is the brand details, what is the content addictions, what is the description, what is the duration, what is the generic name, what are the ingredients, then storage, users, many things. I can extend this up to my requirement in terms of my product information. So the attributes will ensure like that consider multiple vitamins are there. You should be able to keep the details. What is the country of origin? What is the importance of this vitamin? It will be able to take it along with which are all medicines together. Then you can keep all the set of information over here. So a particular person who is walking into the pharmacy will be able to get all these details because the pharmacist will be able to check the details. They will be able to compare the product, show the difference to the customer, like in a website, what you're doing in same way you should be able to do in a point of sale as well. I'll demonstrate that over there. But the best thing over here is now you are keeping the entire product attributes and related information at one place. Then you can use the same information for providing this data to your website or using it internal for your pharmacies or providing this data for your third-party system related with an integration aspect is concerned. So as I have told, this is a pretty large set of application which you should be able to see like that. I'm only showing the retail and commerce module, which contains a very rich pricing priorities, pricing option, my promotion discounts. My promotion discount is pretty big like that. I have pricing priorities. Then I have all discounts, multiple discounts, simple discount, quantity discount, buy two, get one free, buy X, get Y free, buy X and Y, get Z free, buy X and Y, get Z for third price. You buy any product, three products from a category, get the lowest price product free. All this kind of configuration, promotions, everything you should be able to run it along with threshold discounts. If you buy vitamins more than $100, then you will get 5% discount. Or you say like that, okay, you buy vitamins more than $100, you will get some certain supplements free related. All these entire set of promotions which it is required for you to run the pharma business is completely available inside the application. So this is one application, which is the retail and commerce. You can see it's a rich set of function available, which is having the end-to-end setup to manage an e-commerce website, to run a point of sale, to create a order management solution. If you are having aggregators, then you can integrate with that one, and from there as well, you should be able to run it along with their operation application is concerned. Okay, so that's all about the this one. Now, if you see like that is one module, then we have the complete insurance module, which it is available from insurance. You should be able to define what is the insurance company, the empanelment details and everything. Let us say there is 5 empanelment only available out of your 50 stores. Some insurance companies say I will only cater to this 5 pharmacies only. I will not be available. And you can control all these details using the empanelment aspect is concerned, which will help you to configure that in system, which insurance companies are accepted, what is the network masters are available there, what are the other component aspect of so on this particular pharmacies, I should be able to say like that, okay, this allowed American life insurance, this self-paying customer, which it is available, whether PBM enabled, what is the start date, what is the expiry date of this empanelment, then what are the networks are included as part of that one. If there is a credit limit, if there is an exclusion list, let us say if some medicines are excluded, then you can specifically put a control over here. This may not be particular applicable, much more useful for a country like UAE, because here everything the PBM is there. But you look into the other region, the empanelment, the insurance, the pharmacy PBMs are not sitting in between. In this region, the pharmacies will be able to control what medicines are available for a insurance company to them. Then you can say some particular supplements, vitamins, these things are not available. Then you can set up your exclusion list, approval required items list. This every detail you can put up in the system. So you ensure like that, okay, doesn't have much revenue leak, because when I dispense a medicine, customer take it, then I will not be able to get the money if the insurance company denies that one. So I can avoid all these controls by putting the things inside the application, and I should be able to completely do the tracking over here. If it look like that, okay, I have the entire cycle, which I will show the details whenever it's coming. So the insurance transaction details, let us say one particular insurance transaction, how the system look into this particular transaction, because it involves multiple cycles, right? Because a customer going to a medical practitioner writing a prescription, a customer coming the prescription with the pharmacy, then whatever is the medical practitioner written only should be dispensed. So when they select the prescription, the particular prescription should contain only the medicines over there, whether it can be manually created or it needs to be downloaded from a PBM system. That depends on different regions and things which you should be able to configure over there. So once I done that one, then I should start dispensing the medicine. Before I start dispensing the medicine, I should take approval from the authority, or either from PBM, or I should ask the particular insurance company whether I can dispense the medicine. Then they dispense the medicine. You should record I dispense the medicine based on some particular approval. Just let me. Okay, then I'm dispensing the medicine based on that one. Then I get an approval. Then the approval related code, detail, everything I should manage inside the system. Then once I complete the approval process, I need to submit it for getting my money. When I submit it for getting my money, the insurance company says like that out of these 5 products, 3 products only approved. Related 2 products are not approved. So you should be able to track this entire transaction inside the system. Then you say like that this particular transaction number, it contains, it dispensed from this store. These are the product. This is line number 1, requested quantity, approved quantity, how much I requested 10, they approved 10. What is the unit of measure? What is approved unit of measure? Requested line item, approved line item amount, patient share, how much, amount paid by insurance related. If there is a denial code, what is the purpose? What is the comments? Then manual approval related entire details, which it is captured inside the application. Then you say like that, what are the diagnostic details? Then based on what diagnostic this product are details. Then the observation details available inside the ERX, how the details are entered. Then whether you say like that, this particular claim got submitted, whether I have submitted. When I submitted, how much quantity I submitted for 10 and 24 quantity, then what is the patient share? Then how much money I have received in terms of ERA as well. When I received my money, the ERA details as well will be there. Then the ERA line details will be there. That means tracking from my transaction creation from my ERX till my ERA settlement, the entire details are available for your operation aspect is concerned. This is pretty important because you have multiple communication. You submit a claim, you reject the claim, then you resubmit it. You get the entire details which will be available over here. Then you will be able to say like that, what is the total rejection happened over the period, how much I lost it because I serviced a customer, end of the day, I'm not receiving my money on time, it's my problem. Then I have multiple dashboards, everything is available, which we will demonstrate over the period. Have any specific questions in backend, then I will move this into my next session in point of sale. If you have specific questions in this area, please ask those questions in the chat. Then I'm willing to answer those. Okay. Now I I'm just moving into the point of sale. This is a point of sale which got installed in another machine. So this is a retail point of sale. This is where the data, whatever you have seen the back office application, this is the retail point of sale. And the good thing about this is one application, which doesn't means like that you need to push the data, you need to integrate nothing. Automatically, when you have some data published over there, that will be available in My System. Then I can design my entire point of sale screen, everything using my backend system over here. That means every customer will be able to design their screen. It differs on different form factors and everything. They should be able to design it accordingly. So I just created Pharma 365 for one of the demo purpose. You can brand line everything based on your requirement. And the best thing about the system, it doesn't require a dedicated point of sale. You can run it on mobile device, you can run it on browser, you can run it on tablets, or everywhere you should be able to run your particular application. You doesn't need to have a specific point of sale system. Then according to your requirement, you should be able to select any form factors required to run the operation. Like that, you just want to talk with the customer, show them the product details, then make them select, then discuss them more details, capture additional details and information from them. Then you can use the Pharma post for getting it done as part of that one. Then it's same like you can log in using a user ID and password. This is the Pharma 365 application, which contains everything related with your shift operation, your start of the shift, your dryer operation, your set read, X read, all these things are built in. I doesn't want to go into much deeper because of the limitation of the time. But over to here, then we will be able to talk about by saying like that how a particular transaction, which it looks over here. Then I'm coming into my products. If I'm coming into my transaction screen, in my transaction screen, I should be able to see the complete actions, my insurance related transaction, my discounts, my payments, everything I should be able to conclude. I can add a product, I can add a normal customer, I can add an insurance customer, everything from here, which is very simple and similar to whatever which you are doing. And I can do my stock reports, lookups and everything. Whenever a customer coming asking a product, I should be able to look into my stock position. Then those details will be available. Then the categorization, what I have done inside my system, the similar categorization, my products are available in my point of sale for me to look into that one. I'm selecting one of the product. Now you see the rich set of product information, which is available with the images, its prices, related details and everything. I'm selecting one of the product. Then this is what I talked about, the attribute framework. You should be able to keep the entire details of the product inside the application. You doesn't need to only stick to the knowledge of the pharmacist standing there. Instead of them, you can enable them to look into the details, and from there, they should be able to start selecting the product. Then you can see the details of the product, how much stock is available currently inside the particular store. What is the stock availability of this product. When I select, immediately it will display 120 stock is available over here. Then I can see the stock positions of other stores as well. If in my store this is not available, in other store how much it is available. So I can say like that, okay, I can show the store location. If the customer asks where is the store location, then I can provide the details of the store, its location, navigation, every details back to the customer. Then on this particular store, how much stock is available? If there are this particular date, there is 720 is available to promise in this store. But for other store, this particular store, if I look into my show stock availability, I can see like that, okay, this store as well 40 is available. If there are multiple orders, because I'm getting another customer has ordered, then system will completely show you what is available promise based on the date. I don't have much details. But if you have a purchase order coming in, system will say like that in this particular date, there is additional 50 pieces will be coming. Then you should be able to show the complete available promise information from the location where you're standing. So it enables you to cross sell or sell as a business. You should be able to decide like that. I'm going to serve my customer from anywhere the stock is available. Then I can say like that in my Annapolis pharmacy, I have 550 stock is available. So I look into the store availability. I can say like that, okay, how much stock is available now, related details, how much there are on order positions, everything, how much are reserved, how much are ordered, what is the stock keeping unit, every details will be available for me over here. Then I can say pick up in this store, then I can say a customer coming to me, I say like that, you go and pick up in this store, then I can direct them to create a customer order directly for that particular store. When a customer goes there, you should be able to pick the product from there because the order getting created, the money is collected in the first store, then the entire transaction is getting done very quickly, and the customer will get a very similar experience, which will be very good for them. So I can select, then depends on the location which I should be able to say. I can start selling this product. It's pretty simple. I selected this product. So in my cart, when I go and look in, I should be able to see there is a particular product is available. But as you know, like that, this product I am selected there without scanning this particular product, I need to start allocating a batch for this one because I need to ensure like that the customer scanned this particular batch and the batch code selected as part of the product, which will be able to control completely because today the batch information is coming from this particular QR code. Uh, Based on the GSM based QR code is coming. So I can simply go into my notepad where I can scan the product because I cannot attach a scanner over here and selecting a product. Then I scan this product. Now system will look whether there is any product which it is there, the scanned is available. Then I see like that there is one quantity selected by here. Then I am attaching a batch. If I directly scanning the product, Anish, can you scan it again? Can you enter the Now I'm simulating how I scan another batch. Now you see like that, okay, this particular product, I scan this directly. So system will automatically select the batch number 100, which is having an expiry date of this one. This is a particular unit of measure. I am selling it in form of box, which is a quantity. What is the selling price out of it? This is a over the counter. It's a prescription medicine. Then what is the sale? Then I say like that, okay, customer making the payment. I'm not selecting any customer, nothing. The customer is making the payment using card, Diners Club, Visa card, anything. You can have even multiple currencies as well. You can say like that the customer pay using any of the different currency as well, which you should be able to configure inside the system. So say like that the customer pay using cash. I selected the cash. Okay, in a denomination of 35.80, customer paid $500 or 80, whatever it is. Then what is the pending payment details? The transaction got completed as part of this one. So it's a simple OTC sales which I have completed. I selected the product, I scanned the product, then automatically system ensures like that it's a batch control product. So the batch product are selected by the customer. Let us say if there is non-batch product as well, directly they should be able to scan. They can add the product, they can select a non-pharma product here. How much details? Abstract. Did I? So this particular transaction, I should be able to complete very quickly in terms of this one. Then I can avoid the product, clear the quantity, related everything that is related with the regular operation which it is there. So I can start my transaction in terms of if you look into this is a primary thing which it is there. Here you should be able to say like that, okay, I have multiple dashboards available. I have an HIS viewer. That means if my orders are coming from my hospital information system, then I can integrate the HIS system over here. That means nobody required to punch or make any mistake inside the system. When I can click the HIS viewer, I should be able to see from my location, if you have a multi-tenant, multi-clinic integration, then you can get it integrated with the multiple clinics. Every clinic sending your transactions, then you can capture the transaction over here. Then you can serve their customers. Then the good thing is you doesn't need to create a customer, collect the details, everything, because from a clinic, you already verified the customer, you collected their records and everything. So you can immediately select the customer and you can create a customer, you can process the order automatically. Once you click process the order, system will automatically create the customer. It will download the product related details and everything into the system. Here you see like that there is a rich set of information getting captured, whether it's a type, OTC, what's a prescription number, prescription date, what is a doctor name, order type, there's a clinic visit, which clinic it is, the member ID details, all these details are captured as part of the system. So this details, which is the Emirates ID, what is the pair details, which is the insurance company. So nobody doesn't need to repunch the details because details are absolutely captured in the HIS system. So you know, like that, you should be able to serve the customer within no time as you have the entire details and transaction data available. Here the good thing, if you have standalone pharmacies or if you have a clinic attached pharmacies and everything, you can utilize standalone pharmacies. You can make an integration between nearby healthcare solution providers, or you can get it done through a PBM or anything based on your thing. Okay, this way you can select a customer, you can process this particular order. And there is a transaction which it is running. I need to avoid. Okay, Anish, can you just navigate through this one? Then the other thing is I have an ERX viewer available. Inside my ERX viewer, I have my entire customer record, customer name, my ERX number, details, everything is available. So I have my build ERX, picked ERX, my mismatch ERX, my pending. All these details are available from single dashboard. I can show you one transaction. I selected one particular customer. I can edit the ERX as well, if or I will be able to view the ERX details. Let me show the view the details. I can see what is the customer code, its name, date of birth, what item codes which it is written over there. Then what are the diagnostic code which it got created? What are the observation details? Everything is there. So this is a completely matched item, then changed item and everything. Here the provision is available for me to print the line dosage, or I'll be able to print the complete dosage information. That means in a dosage label, it will completely load the product. It will be able to print the details, everything, whatever it is required, it will print it automatically from here. Then it doesn't need to write in a pen and paper or everything. It can print in a sticker. You can put it inside the particular medicine where you should be able to complete. You can edit the ERX over here if consider there is a rejection which it is getting, or you want to create some additional details to be put over there, then these details can be done. Like that, you ordered paracetamol or a brufen, there is an alternative product available. If the product is not available in times your store, you should be able to substitute it with the related products, its item ID, everything can be done from the transaction. So it helps the pharmacist to completely do the transaction inside the application rather than moving into multiple places or anywhere. They should be able to completely do the operation over here. Now the doctor has written this quantity, this product related observation codes, details, everything which it is there. You can add new observation code. You should be able to change that one. You should be able to edit according to the permission what we set up in system. So it's pretty simple. Now I have selected the ERX. The customer got created along with the product details and everything. Here I'm not doing anything. I simply downloaded an ERX transaction. Now next what I will do, I will send it for approval. If I'm getting my approval, then only then I have to do it. When I send it for approval, it's sent for approval. The request has come. OK, then I can just wait for my insurance dashboard. I can check there how many are applied, how many are approved, how many are partial, how many are rejected, how many are cancelled. All these details are available. Here you should be able to see like that. What is the prescription date? Whether there is a client name, whether there is any denial, all these details, you should be able to see it over here. Then you can take decisions very quickly accordingly. When you select on transaction, Anish. Then you can select an approved transaction. You can view the transaction. Then you should be able to completely view what is the patient share, what is the net amount, how much got appraised, what is the PR quantity, what is the purchase requisition, what is the approved quantity, entire details, what is the copay amount, if there is a denial code, the details, everything will be available here for you to do the transaction proceed. That means the based on the response from insurance company, you can see it, whether you can talk with them, you can understand why they rejected everything over there. Once I selected the product, then company total, how much required to be promote, what is the approved quantity, what are the observation code here, what is EDC code, which I have mentioned for that one. Then the copay amount, item name, batch number, whatever is the details required for you to take a decision or take a conversation with your insurance company or with the customer, which it is completely available for you over here. Then next is I got an ERX because I didn't scan my product. Then I can send it for my batch selection. Batch selection is physically scanning the product and ensures like that I have put up the batch quantity, related details and everything. So it's pretty easy in terms of I'm keeping the QR code information available from my medicine. As I am not scanning, I just scan the details because you scan it, that's the results that's coming. The billing quantity is 1 and the batch quantity is 1. The batch unit is unit of measure is each as well. Then once it's got matched, then only system allows you to complete with the transaction. Okay. Now the price was overdone because of the insurance company. You are having multiple contracts based on the insurance company. So the regular price can be different. Your contract with the insurance company can be different. Then accordingly, system will decide the pricing out of it. Then you complete the transaction. Then you are sending it for insurance company for getting an approval. Now system slice like that. Okay, the amount due is 28, but the insurance company will make payment of 20 and the remaining 8.5 is copay from this particular customer, and the customer pay the copay amount accordingly based on the balance what is approved by the insurance company. Now you received the pair amount, you received the copay amount, everything, and the transaction getting completed. Now Now, if you look into the bill transaction, you should be able to see the complete bill transaction. It details what is the claim status. That means once you immediately submit the transaction getting completed, immediately system will submit it for a claim process from the insurance company, because it's not which it is created for UAE regulator compliance. It doesn't mean like that we can not modify it for other region. We should be able to get it accordingly, just tweak here and there for getting it. But whenever the insurance transaction getting completed, immediately now you put your transaction for a claim submission to the TPA to ensure like that you are receiving the money on time. If there is a denial, there is a details, everything they should be able to see it over there. Then you can have the complete bill transaction details, your approval, your insurance dashboard, your ERX viewer, your HIS viewer, everything which you are doing from this place. Then you can select the insurance observation, doctor ID, everything. On top of it, we have created home delivery transaction as well for here. If an insurance transaction which is home delivery, then you can create it as a home delivery transaction, and from there which you should be able to get it completed. So as we are running a little short of time, I'm just trying to uh, uh, say like that. Okay, we have seen how an insurance transaction is done, how it is seamlessly integrated with multiple providers or regulatory compliance and authorities, but application is seamlessly providing the entire data to the pharmacist standing in front of the customer. They can even serve the customer much more better with more intuitive details for them to take decisions and provide additional details to customer aspect is concerned. So few additional things is like that. Here you see the simplicity of creating a customer, because the customer details, everything is coming from the insurance transaction, ERX and everything. If the customer is not that way, then you can immediately create a customer as well. You click the button, create the customer, you can enter the details. But consider here it's already integrated with the Emirates ID. Then you put up the Emirates ID into the scanner, then read the Emirates ID, then system will automatically fill most of the details. You doesn't need to punch the information. So it ensures like that the hassles of the pharmacist is getting reduced in whichever possible manner. They should be able to serve the customer in a much more quicker manner compared with the other operational aspect is concerned. Then you can create the insurance company, you can create the customer code, you can search a customer using their name, mobile number, email address. Those are standard simple. I doesn't want to go into the details. If you look into the customer, you can see a customer profile with the entire details, its address. If he's having multiple patient profile like that, your medical records are multiple, then that as well coming. Then if there are multiple insurance profile, if one customer is having multiple insurance as well, because I give my insurance company my insurance profile, my son, my daughter, my wife, everything I should be able to keep the insurance profile. Then I can see the loyalty related rewards information, everything. If it's related with a loyalty customer, then their entire recent transactions as well, like that, what are the customer bought recently from you. So which will enable you in such a way like that you have seamlessly capturing all these details related with the customer, which give you much more details whom you are serving to. The details are available for you to serve the customer much more faster. So this is all about this one. Then you know like that there are multiple reports are available. What is the card payment, cash payment? What is the sales by step? What is the top 10 products which I sold today? And all these regular details are available. And the D365 frameworks allows you to enhance this particular thing. You can see the day summary details, everything over here. Then bill insurance transaction, retail payment collection, all these details are available for you over here. Uh, that's all about the point of sale. Once I complete the transaction, as I have told, the complete details which I have shown, which is available over here in form of transaction with the related details and everything which is real time as well will be available over here. So it's a seamless experience for you as it's running short of time. I may not be able to cover the entire details, but as a business, you have the entire related requirements for running your pharma business related with the insurance claim process. Everything is available out of the box from system. We are just moving to the other details very quickly, which I will show you very quick as part of that one. Then the pharma post is available, then the insurance profile related details, and the batch tracking completely controlled along with this one. So this particular application, this contains the optical prescription as well. That means if you are running the optical shops as well, you should be able to complete your optical related operation in terms of their optical prescription. Everything can be handled using the system. These are the rich set of promotions available: gift with purchase, tender type based discount, optional company overlapping discount, price simulator, coupon codes are available. You can sell a product, give a coupon, then the coupon can be redeemed and another product is everything. I'm not moving into much details, but it's much more complex details you should be able to capture. Then there is a clienteling is available. That means you can keep a client book. You can keep their activities note, their records, their letter details, everything which you should be able to cater as part of the application aspect is concerned. You should be able to do it. Then the customer insights, you can do your customers, you can completely do their sales insight, your campaign insight, their segmentation, their chain report, the customer insight, your loyalty insights, everything will be available as part of this one. You can clearly understand what the customer is buying, how to run a campaign for them, how to send the marketing campaign, QR related activities, everything you should be able to do it over here. And this particular product contains the rich set of dashboards as well. You can see how much insurance claim which I have received, insurance CRM, total reported claim, how much is there, how much got fudged rejection, how much got happen, which insurance companies are rejecting more, what is their status. All these details are available as part of this one. Along with that one, a rich set of uh, dashboard available for my sales, my live sales, sales inventory, my stock position related details as well. Everything is available as part of that one. Then on top of it, you should be able to do a stock consolidation report. You can see like that, okay, I just need to do a stock consolidation. Then the system will help you to do all these things from a dashboarding standpoint. The digital receipts are available if you want to run your promotions, your digital receipts along with your promotion related details, everything. You can embed at both e-commerce links along with the product receipts. Then system will recommend the links for the customer along with the receipts whenever they reach to them. Then you should be able to seamlessly create all these digital experience using the application. Then you can enhance the application using power apps in terms of recording your cash handover report, your daily banking report, daily sales report, and credit card slips, consumable request. Excuse me. All these details you can digitally enhance it further, not from where we are standing, but we should be able to further enhance that into the digitalization using the low code platform for your entire digitalization. That means every paper you use, like that a consumable request is there. I doesn't need to send an email. I can come into consumable request here. When I create a small application there, you press the consumable request, then they should be able to fill the details, then it will digitally goes over there. This kind of quick application we should be able to develop. We should be able to embed with that one. Probably TSC got hundreds of such application in our different clientele creation and everything. Then based on the customer request, we should be able to get it created and make useful for them in terms of digitalization journey. What we promise as part of this particular product experience aspect is concerned, we promise you like that there will be paperless experience, whatever it is, whatever operation, who is the stakeholders, who is the parties involving as part of that one. We should be able to bring everything into one collaboration platform. We can create different set of application for getting it done in terms of the requirement aspect is concerned. I'll show you a couple of dashboard as well, little over here, then over to There are a rich set of dashboard which is available: sales dashboard, sales versus summary, what is sales versus target achievement, your molecular dashboard analysis, your live sales analysis, corporate sales, area-based sales performance, related everything which it is available. Then sales summary, what is the time period, what is the month to date, what is the year to date, whether how much difference is there in terms of this every aspect. There are many dashboards. As the time not permit too much, then which will be running here, you should be able to see what is your sales. Your sales is increased by 8.5%. It's increased because there is 1.5% increase in transactions. There is 6.9% increase in ATV. The ATV increase is because it's because the absolute basket size is increased by 3%, but your average price quote increased by 3%. So you achieved 8.5% sales over the period which you have selected, but this is achieved using increased price or number of transactions coming into the system. So there are 10, 50, 100 dashboards are available in different aspects, but difference on your requirement, we should be able to look into the details over very specific sessions. Now I am handing you over to any specific questions in terms of here, which I should be able to answer. The invoices we should be able to send copy. This is Anish. Can you show insurance invoice bill on copy if we have any such? One sample is available that we can send to Dr. Hani as requested for this one. Then we can provide the details to you, sir. One specific question. See, previously we started this implementation with the BYOD concerns, but now completely the data we are moving into Azure Data Lake. From Azure Data Lake, Synapse is reading the data. From there, we are transforming the records into reports, and from there we are doing our entire reporting aspect is concerned. But it's nothing meaning like that. The entire reporting required to have the data lake capability. But a lot of things which we have created entity framework, which we using the DW itself for creating the report. That's where most of the report, the transactional reports are coming. When it's moves to very high level analytical report only, which we say like that, okay, the analytical report only which you are pushing into the data lake aspect is concerned, but we are not pushing the table level. We are pushing the entity level records over there from there, which you are keeping over there. So I just it's almost 3:12. I'm just pulling and giving this to Sadish. Now we have to continue with the sessions of two things like that. One is we just need to finish the distribution management challenges in terms of pharma retail. Pharma aspect is concerned. We are not moving into the regular other product related. We will only very specific to the pharma related challenges. What kind of enhancement TSC has done to cater this particular industry from the application? That over to Sadish. Then we have a little more transactions like that. Any HIS company, any clinics or healthcare solution company, we know like that the HIS solution, whatever which you are running, it's very primitive in terms of the inventory management, it's finance management and related things. You should be able to run your existing system completely for your operation, your patient journey, your the doctor to interact. All this you should be able to use your things, but you should migrate into D365 for running your ERP related stuff, your procurement, your control, your budgeting. Then for your claim process, this everything you should be able to run it in terms of your ERP, but you can still continue using the HIS system as the operational application. Then you should get the budget control, you get the approval mechanism, you can have the much more vendor collaborations will be much more faster. Then there you can cater the entire other aspect of the business in a much more controlled and efficient manner. Over to you, Sadish.
Thank you, Sajid. Good afternoon, everyone, and good evening. Let me share my screen. Hope everyone can see my screen.
Yeah, Sadish, it's visible.
Yeah. Okay. So yeah, as Sajid said, we are focusing in next 30 to 45 minutes only based upon the pharma distribution and the hospital management system. How can it gel with the D360 financial operation? So we are focusing on only those two areas. So normally, the pharma distribution, if any company, or obviously a distribution company starts with an incoming of your material, which can be purchase order, and how your material is inverted, and from that inverted, how material will be dispatched to your customers, and internal operations like your replenishment, counting, and any if you are transferring the outbound can be a transfer to your child pharmacies, or it can be your own internal intercompany transactions. So the whole operations in each process, what could be the challenges of the pharma industry, what they are facing, and how can we control the data entry errors or any the data inconsistency? How can we control that? So these are the pain points which we are going to address it. Now, we are not going to talk about the regular purchase, regular sales, and the transactions which we are dealing with the normal ERP system. So let's take the first invert of the material, which is a purchase order. As you say, since it's a pharma industry, we need to design we need to design our warehouse layout, which should be there should be a two differentiation of warehouses inside your same premises. Because a pharmacy product, we have n number of classifications. Because any pharmacy, it can be it should be temperature control. It should be the proper chiller area should be there for a certain drugs and certain pharmacy items. So all these, how can we handle it? And this explanation is blended with advanced warehouse management and landed cost module, which has D365 has recently released. So we are blending those concepts along with the pharma distribution, which we have implemented recently for certain clients. So when a layout has to be designed for the pharma distribution warehouse, it has to be a receiving area, a sorting area, which because it can be coming from the different containers, and then the different pallets will have as a different same items would be kept in the pallet, and the vendor have been distributed through the shipment. So we need to sort those items. And then after the sorting, there you should have a bulk storage area and your picking area. And also, once the picking is completed, and when you are coming to dispense the material or dispense the items to the customers, you should check the expiry of the product and how, as per the order, it have been the warehouse worker has picked it. So you need to check all your preliminary checkups has to be done before you dispatch the items. That is called the packing station. And then the shipping area is the final dispatch location as per the invoice versus the number of items. So this should be an ideal main warehouse layout, and it can be different, or it can be designed as per the different pharmacy businesses which you are carrying on. So it's not a thumb rule; it's a suggested approach which we are showing up. And next is the quality, because normally all the pharma industry has a big challenge on the returns of the items from your different pharmacy industries, because it can be when an item is sold to any pharmacies or any distributor, they may return back your items due to several reasons. Once the return is received, okay, whether the QSC team has to check whether it can be resellable, our items can be resold to other clients or not, or it is in any damages there in the pharmacy bottle or any carton boxes, or if the vendor has already sent, which we have not noticed, and the vendor damage is there, or it is near to the expiry, because when we sold to the customers, it is almost close to the near expiry, so that they will discard from their pharmacies and return back to the warehouse. So how to classify all these type of return types? So that's how we need to able to classify a different location in order to how to dispose our items, how to recycle our items by putting back to the bin location. So these type of areas which we need to take care when the returns are in the huge volume of the business. So we need to plan accordingly for the warehouse layout. So this is a quick glimpse of the warehouse layout. Now coming back to the incoming purchase cycle now. So when obviously the most of the drugs, it can be local purchase or it can be the import purchases. So in case this items or this particular slide is clearly describing about the import purchases which you are making from the outside the UAE region. So as you know, now it is currently a GSO enabled, and the vendor has to upload the serialization numbers. And then now when the multiple purchase orders have been prepared for the import vendors, and we will be receiving a shipment along with lots of FOCs. You know, like normally the vendor in the pharma industry, they used to give the ordered item. Along with that, there are lots of FOC quantities which has to be given as a sample, or it can be the free of items which should be used for our marketing strategies. So it can be several reasons. So, but in a single purchase order, you may have lots of FOCs as well as the billable quantity for the vendor as well. So how it can be clubbed into a single advance shipment notice from the vendor. So you can have an option when the landed cost module is introduced. You can able to create a voyage which you can club the multiple purchase order into a single ASN, and then you can able to receive those purchases. And how can we track our shipments? Because we know the lead time, but what is the actual, because there are lots of clearances in different ports since it is related to the drug chemical industry. So what is the real tracking of the shipment is happening? So how can we track it? So those things can be handled by the journey template, and it can be integrated with any the tracking agency, so that we can able to in real we will come to know the real time travel of a particular container. Then the purchase price calculation, yes, obviously you'll be having a trade agreement, vendor based, and it's a currency based trade agreement, which you can able to set up in the system to take care of the purchasing price instead of any manual intervention. Then how does the FOC or bonus item calculation can be addressed? It can be addressed through the auto supplementary item calculation. There is a default feature which is available in D365, wherein if you upload this vendor, if I am purchasing this item, what could be my set of FOC items which I am about to receive? When you create a purchase order, system itself will suggest you that this is the expected FOC quantity to be claimed from the vendor. So this is how you can able to deal with it. And what is the freight cost or landed cost? Because that is the cost which you place in the purchase order is only the material cost, but what are all the other components like freight, customs, insurance, or how it can be loaded? That is automatically dealt in the landed cost module, and it auto load the cost into the item cost of the drug. So this is how it will deal with the perfect costing of an item. So how can you evaluate the vendor through whether as per his commitment to have delivered correctly, or is there any shortage or over delivery of the items? You can able to deal with under and over delivery transactions through the landed cost module. If it is an over delivery of an FOC item or a normal billable item, auto purchase order will be created by the system, and it will be in the received state for the further processing to the finance department. If anything under delivery, it will still stay in the GAT warehouse of the under delivery warehouse, and it can be either write off as per the vendor agreement, or it can make a purchase return to the vendor if it is purchase return to the vendor to raise a debit note to the vendor. Okay. Now, what about the damaged item? How to deal with it? It depends upon the it's scenario based. It either you receive the full quantity and then transfer to your damaged warehouse location and then raise a credit note to the vendor. This is the ideal situation, and easy to handle the returns of a damaged item. So these are the total processes or challenges which you may face in the incoming of the material purchase order process, and this is how you will be able to address those challenges. And next is the outbound. Like now, let's say the sales order process where you are able to going to distribute your items to the different customers. So there are lots of challenges which is facing in the outbound is that your order types, because when you deal with the distribution, you need to give compensation, you need to give an sample, you need to give extra bonus, you need to deal with the different MOH samples. So lots of orders types are involved in the distribution business. How can we cater it? How can we control by the user? Because an user cannot, because every order treatment is different. how can we make sure that the order processor is following the certain SOPs in order to complete those type of transactions. In order to address these challenges, we have a separate matrix parameter wherein each order type, how the system has to behave, what control has to be done. That was dealt in the sales pool, which I will be showing you in the following screenshot. So what controls, what process the sales order processor has to follow. That's how the order types is dealt with. So then there are every salesperson or every sales rep will have its own the way of negotiation to the customer. Few people will say will play with the selling price or different strategies, or other sales representative may deal with the FOCs. Several people will deal with the bonus quantity, and so the different strategy of the sales representative for the customers, all these has to be loaded to the system. So whenever an order processing should happen, there should not be any manual dependency to verify the data or collect the data from the salesman to make the process. Once the agreement is done with the customer, load all the data into the into the system, then the system will take care of the set of sequences what it has to done. For example, if you specify the prices as per the agreed price, upload the trade agreement, and system will auto suggest the price, and there will not be any editing option to the sales order processor, or he can key in the prices as per his wish. It will not be possible. And there is another chance that he can able to he can able to cross verify the LPO unit price which customer has provided and what system is suggesting you the price. So there is a cross verification between the billable pricing of the item. So there is a special, any discount or any special order, someone has to follow an approval to the management in order to process that particular order, but it should not be applicable for all the orders. Only for this particular type of order, I need to apply the workflow for this management approval. So how can we address it? So we have a custom workflow based upon the order type, so that it will control the workflow process. Then the bonus calculation which we set, and if one item has been produced, it should be given as a free of charge. Or other customer may say, no, I may not accept anything in the zero price in the invoice. So you create a separate bonus order with all the price and provide me the credit note. So every customer will have its own terms, because customer is a king finally. So he used to recommend what the way of the invoices which he need and how to able to handle that. So we need to enable the bonus order setup as per the customer, and then when a normal order is completed, a system will auto create the bonus order with the agreed price, and auto credit note will be created, and it gets settled against that invoice. So this type of automation will help to reduce the manual work, manual checking, and the finance team has no hassle to cross verify whether the debit note has to be raised or no. So there is no need of any manual intervention in that. And as you say, there are lots of promo packs can be set in the system, whether it is a pack of 2, pack of 3, and there could be like a mix and match of kits can be able to made, like buy 2 get 1, or the same item buy 2 get 1, or you can able to set if we buy the product line of X brand, you will get the same brand free. So all these can be addressed by creating a kits, and then you can able to sell it in the sales order by using the kit. Okay, so these are the sales orders. Now I'll walk through the setups which we done in the D365. As I said, these are this many orders can be prepared, or the type of the orders will be prepared at the time of the pharma distribution. It can be like export order, it can be general order, it can be for the lab testing for your drugs, it can be listing order wherein you need to list the products to the customer pharmacies, or you need to give marketing sales orders, or you need to give, because since the advanced warehouse management is also tightly integrated with the process, a manual picking or the manual journal for the item is not the right way to do it. So everything should route through the sales order, and it should route through the advanced warehouse management picking process. Then the dispatch has to be sent to the customers by following the order types. That is the reason all the any outbound of an item should flow through the sales order. Now, if you see, there are lots of controls which I said. If the order type is general sales order and some drugs has to create a bonus order, only for that particular order, a bonus order will be created and auto credit note will also be created. And whether should I want to do an auto reservation for this particular sales order or no? Should I want to edit the price for this type of sales order or no? For example, there are some orders which can be tender types. So if you are giving any the government tender or you are committing the pharma distribution to the government or maybe hospitals or anything, if it is a government order, you may need to just a second. 1 second. Yeah. So you need to provide you need to give an editable option to the salesman in order to edit for the tender price, because it cannot be normal listing price. It should be a tender price. So this is how the edit price option for the particular order type, if you want to control, I can able to control it. And the workflow, as I mentioned in the earlier screenshot, if I want to apply the workflow for a particular order type of the sales order, I will initiate the workflow. So before the completion of the workflow, the warehouse management or the picking process will not be initiated until the management is approving that particular type of an order. And the reason code is like any returns are coming in, I want to capture the reason code of the return sales order type without any excuses. So these are the major controls which we kept in order to process those orders for you to handle the operations, so that the sales order team or sales order processing person does not want to remember anything on the particular thing. So this is a sample screenshot of your bonus master. Ideally, the D365 finance and operation will have the quantity basis, only the bonus can be handled. But we have fine-tuned the, like as I said, the bonus order as well as the percentage also. Like say, if you buy from quantity to quantity, how much percentage I can able to give. If it is more than 25 quantity, how much percentage I should give as an FOC or the bonus quantity. So these type of all multiple combinations of your the FOC and bonus can be handled by the supplementary item master, which we have fine-tuned for the pharma distribution. And next is the major challenge is the reservation. Because as by default, any ERP system will first consider the expiry of your first in, first out. Whereas the customer or any distributor, the major distributor will face the challenges that because this customer will always agree to receive his items only if the item is more than 365 days expiry, he will accept those items. If not, he will not accept your goods. Or some customers will say, I can accept, but I need an undertaking letter in order to receive the goods of pharma, which is it is not meeting my expiry criteria. So the different items of different shelf life of different customer of these many combinations, how to address it? Because few items shelf life could be different, customer expectation is different, customer hierarchy is different, or the terms could be different. How can we address this? So this is where like we have found out some solutions, which is coming in the sheet. Like we have given a reservation mechanism to the system. Like if any customer of a sales order on any combination of an item, find out the reservation criteria for the customer and pick the right batch from the inventory on and from the main warehouse or the distribution warehouse and reserve the item. This is the logic we built, which I will show you in the screenshot. And if you can see this, and you can see the picking criteria, which is set for any set of group of customers. We can group the customers or individual customer or individual item or a group of item. Any combination can be set. And then you can define how many days, like 180 days. From 180 days, the customer will agree any expiry date, or between 225 to 365 only, this particular customer will receive this type of items. So you can specify your own set of criteria of the picking, and you will specify this customer will always require the UTL letter in order to, whenever we are dispensing the items to the particular pharmacies, they may need the UTL letter in order to agree that whether can we take the goods below the expiry criteria. Okay, so by in this way, you can able to override the default reservation of the system and meet the specific criteria of the customer, so that your major challenge of your returns, your because when the criteria is not met, immediately this is the pharmacy will return back the item if it is not meeting the shelf life criteria. So in this mechanism, your returns will be very less, and then it will system will take care of the expiry of the expiry items, how it can be reserved to the customer. It system will automatically take care of that. So these are the challenges. Now, this is it's a kind of advanced warehouse management concept, how to consolidate a picking list of the same customer with multiple orders, and the journey of a warehouse picker, how it should be very seamlessly. There should not be any repetition of the warehouse worker to move here to from one location to another location. So as per the sales orders, as per the picking location, he should complete a whole picking of the order through a journey. So all these can be addressed by the advanced warehouse management setups like work template and location directives and group put away, so that you can able to address all your pharmaceutical picking operations through the advanced warehouse management accordingly. And using the load planning workbench, you can consolidate multiple LPOs from the customer, and you can able to club it for single picking, and you can able to make your warehouse operation very effectively. Okay, these are the major challenges and how we can address through the advanced warehouse management concept for the pharma distribution. And this is the one which we discussed. And as Saji said, as a digitalization process, we have given as an invoice tracking. Once the dispatch has happened from the invoice, a barcode will be scanned, and then an app ID will be generated. And when was the driver collected time? And we need to get an acknowledgement from the pharmacies, from the pharmacist who is residing in the pharmacy. He will give the acknowledgement that I received the goods, and the invoice has to come back to the distribution warehouse, and again the same barcode will be scanned, so that it will track when it has been dispatched and when it has been collected, what was the driver name and what was the lead time. So all this can be addressed by giving a power up, and we will create an auto generated acknowledgement ID as well, in order for your auditing purpose, as it's like a find of a file repository, so that the finding the invoices with this acknowledgement ID through the ERP system, they can able to trace the invoices which is collected from the pharmacies. Okay. So this we have talked about the returns, like how many, what are the types of returns, because when the return is coming back from the pharmacy, we need to classify the items which is resellable, which is near expiry, which is the damage, and then we need to retrieve the same invoices, and we need to specify the reason code per line, because each item we need to specify the reason code, whether it can be sellable or non-sellable, and based upon our quality warehouse layout, you can able to store the items in the respective locations. Because if it is a near expiry item in the QNC warehouse, if you put it in the near expiry location at the month end, which is the for the disposable of an item, it is easy to trace the items immediately, and then you can dispose off from the your near expiry warehouse or near expiry location. Same way, from the R sellable, if it can be put back to the bin location for the further dispatch for other customers, you can able to put back to the main warehouse sellable location. So the return management will be handled by segregating the items when you are making the return sales order and the justified reason code. So a sales return will be handled in the process of QMS. Okay. So the next is the replenishment process. If you have the huge warehouse wherein picking location is different and bulk location is different, and system will automatically replenish from the bulk location to your picking location based upon your expiry. And counting is a regular counting process wherein it has several workflows in order to take your cycle counting, and then it will be addressed to the finance department to look into the discrepancy. This is more of only it is the warehouse operation which can be common. I don't want to go deep into it. And this is the GS1 enhancement. By default, it is system is available. So whenever a drug is there, throughout the journey of inbound to outbound, if you have the GSN code, you can scan the item using our D365 app, which is an advanced warehouse management app. It is by default, it is enabled to do the GS1 scanning capability. And then the system will automatically identify as per GTAN code and barcode, I mean the batch number and expiry. In a single scan, it will seamlessly go and reduce the inputs of the warehouse worker. So that is already enabled. So these are the major challenges and how we have addressed for our clients. That is what our pharma distribution is about. And any specific questions, I'll be happy to answer. You can please put it in the chat box. And since due to the time constraint, we are moving into the hospital management system, how we are able to address the hospital management system along with our D360 finance and operations. So as Sajeev said, the HAA system is your backbone of your operations. But the in order to support your operations, you need the another handholding system for your inventory control, budget control, financial systems. Everything has to be intact with your HAA system. HAS is a product which you all know. It is specifically for your patient journey and your billing, whereas your financial system has to take care of your purchases, inventory, everything. So how it has to gel with the D365 finance and operations. In order to make the HA system and D365 system, there are some dependent masters which is available in order to sync the operations between HA system and the D365 system. First, item master. Your item master can be in any source. It can be either created in your HA system or in D365 system, but it has to talk each other. Once an item is created with all your chemical details, everything, it has to be seamlessly integrated to your ERP system for your billing or any issuance from your stores. So it has to automatically sync between the two systems, but source can be different as per the management decision. Then a purchase has to happen from our D3 finance operation system, and then your material request should happen in our ERP system. Then consumption should be happened in the HA system, and billing will be happened in the HA system, and the consumption details and billing details will be automatically pushed to D365 operations for your financial booking. This is the very simplest or generic flow of an clinic or a hospital operations. So how it can be done. So first is the item master. If you see the item master, whatever the details required between the operational system and finance system, you can see the DDC code. And main thing is there is a significant role between this billable and non-billable. So whether it is a billable or non-billable, which I will explain you what is the significance of this particular classification of an item. And the remaining your classification, as Ajay said, there are lots of custom fields which is particular to the pharma industry can be maintained in the item master. And this is the generic purchase process, which I will not go into much detail with your PR, PO, and GRN and invoice process, which is a very generic process, which is not particular to the industry. Now, assume that your item master is synced and your receiving process, I mean your purchase process is completed. Now, there are several sub stores or sub departments inside the clinic or the hospital system. Hospital, they have several sub stores. So from each sub stores, they will request the material from the main store for their surgery or any consumption or any purpose they may ask for the material. So the purchase, the request has to be made from this particular sub store or sub department. Then it should come to the inventory controller. Inventory controller should review that request. And if it is a If it is a stockable item or which is already available in the stock, he will make a transfer from your main substore to the particular the main store to the respective substore. If the material is not available, he will arrange the purchase, and then after that he will issue the material. And if it is a non-billable item, for example, so he don't want to track the inventory in the substore, it automatically I need to book the expense of those consumables. So how all these can be seamlessly, it can be the operated into the system without any manual intervention or flowing through the multiple screens. So this is the flow. If you see here, this is the requisition from the material substore. So they will ask this much quantity I need, and these are the list of items. So if the material is already available, the inventory controller will verify that, and the requester who is requesting this item will automatically default to his substore, from which substore he is able to requesting the material. So once the request is reviewed and it is approved from the department manager, the inventory controller will automatically create a transfer order from this material request, and the request of the material transfer order will be the reference will be kept in the screen in order to navigate for the receiving the items from the substore. So in case if there are out of 5 items, 4 items are billable and 1 item is non-billable, wherein there is no need of any tracking of the particular inventory in the substore. It has to be consumed immediately and the expense has to be booked for the finance. So there is another automation wherein if you see a transfer order from main warehouse to which OPD department, or it is an operation theater department, how a material will be transferred, under which material request number, and whether it is ship remaining is there or receive pending is there. So all these information will be available in the single screen for the receiver to track the material request. Next is the movement journal, which is the non-billable items has to be consumed immediately. So there is a complete flow of data from which material request the non-billable items have been consumed. So if you see from the request till it reaches the substore, all the process with the classification of billable, non-billable, and every operation is automated in order to make the operation efficiently rather than transfer, navigating to different screens or different request follow-ups is all controlled in the single flow of an process. This is how it take care of the process from requisition to the receiving to the substore. The whole process have been handled. Next, obviously, the consumption will be happening in your HA system, and billing will be happening in the HA system, which will automatically take care in your operational system. Now, after this, now HAS integration between the ERP and my operation system, how it what are all the process can be integrated, what is the financials which should be updated in my ERP system. So here, if you see my there is a HAS module which we have developed in the D365 Financial Operations. If you see, these are the major item master, customer master is nothing but your insurance master, and your all your patient details all will be controlled in the customer master, and item master is the total product list. Either it can be created in your HAS or in D365, it will be sync automatically. Then what are all the transactions happen? Now, probably your billing, your collection, your ERA settlement, because your insurance approval, which I am not talking into it. If it is a pharmacy related, as Ajay said, it can be directly integrated with this. Now we are talking about between the HA system and D365 system. So the insurance claims or your resubmission, assume that it is taken care in the HAs, and the final billing details is forwarded to the D365 financial operation system, and how it is handling it. We can see one by one. So there is a process called bill booking, which means that the patient has been admitted, but he has not yet dispatched. There are set of items will be consumed, so that I need to keep on making the consumption, and then I need to accrue my revenue and accrue my cost of goods sold till the bill is finally finalized. So this is the one step ahead. before the final bill has been finalized in the HA system. This is the actual billing, so that the bill is closed. There is the actual revenue has to be booked and actual consumption will be booked. In between, any amendments between the bill will be automatically addressed from the system. So this is the actual bill booking and this is the flow. So when the HA system will give the details of the finalized bill, and D365 system will store the data, and the batch job will be processed, and then the actual revenue as per the sales order and the payment journal will be posted. So this is the flow and this is the accounting treatment which will happen. If we can see the sample screenshot, as you see, this is my HA's invoice ID, whether it is a walk-in customer or it is an insurance customer, what is the invoice date, what is the invoice amount, whether did we receive any advance for this particular treatment, and what is the insurance share, and what is the patient share, and what is the patient payable. And the total data will be flowing via a patient file number, which is opened in the HA system. So the all the billing details, each bill by bill as per the HA's invoice ID will be captured in the system. And what are the line details? These are the line details for the system will be maintained as per the referral doctor. Let's say in the particular bill, if you click this line details, you will see what are the materials or services consumed for this particular bill, and who is the doctor and who is the referral doctor. And the doctor and referral doctor will be managed in your financial dimension, so that you can able to see your revenue by each doctor as well. And if any doctor commissions or referral doctor commission, if you want to calculate from the system, you can able to calculate based upon the details which is provided by the billing details. So I will show the flow of the commission calculation and the referral doctor commission in the further slides. So this is the collections. Let's suppose every collection, when the bill is finalized and if the patient is paying his the patient share, and the collection have been done, and how the collection will be seamlessly integrated to the system. This is the flow. So from the daily collection, it will be integrated via API, and the receipt ID will be provided to the ERP system, and the D365 system will be able to collect the data in the staging table, and then it will automatically post the patient share payment, and it auto settles the remaining amount, and the insurance receivable which we need to receive from the insurance company will be automatically booked in the system. So if any voucher references is required in order to do the reconciliation, the voucher reference also will be automatically sent to the system. So if you can see the collection, you can see the receipt ID, what is the customer, whether it can be insurance customer or walk-in customer, what is the amount, what is the cashier ID, same the patient file number which you see in the billing details, the same reference will be flowed through the system. And what is the method of payment, whether it is a card payment or is a cash payment or through the bank transfer. And you can see there is a two transaction type. One is payment and one is deposit. For example, before starting any appointment or any treatment, if the customer would like to pay the advance or deposit or to book some slot, and later he will proceed the treatment. So you can able to identify that using the transaction type, either it can be deposit or payment. So it will stay in the advance to customers, and once the actual bill is finalized and when it is settled, this deposit amount will be automatically knocked off to the particular billing details. So a whole collection of each customer of each receipt ID is seamlessly integrated to system, and then the financials have been automatically posting through the system automatically. Okay, so these are the general collections. Means it's the patient share collection apart from the insurance share, and the billing has been recorded in the system. Now ERA receipt, like when the ERA has been given by the insurance system, the back office accountant or back office financial team will book the receipt as per the credited amount in the bank, and then they will book the receipt in the financial systems, which is our D365. So after this, The ERA receipt will be downloaded once the ERA payment has been booked. Now the settlement process starts, because in the DHA portal, automatically they will upload what are all the invoices we have, what are all the invoices have been settled against this particular payment reference, and what is the claim details and denial code, all will be recorded in that particular ERA file, and how the system is reading that file from the XML, or which is uploaded in the DHA portal, and it auto settles the invoices in the finance and operation system. So this process will be entirely automated by taking the API of the DHA portal, and it auto settles as per the ERA file which is sent by the insurance company. This is one of the sample file, like for example, a TPA, any sender ID and receiver ID as per the portal. It will retrieve the file, and then it will store that, and it will show as of now it is not yet processed. It will be either it is processed or not processed, and it will validate the file whether the TPA ID and our sender ID is valid in our system. It validates all your process. Then this is the claim details which is provided by the insurance company, like what is the activity details, what is the ID, what are all the invoices against in this invoices, what are all the payment reference we are settling it. And if we can see the down, what are all the payment amount it is approved, then we will automatically take the payment reference and the total amount and the invoice ID. A settlement process, or the system engine will able to do it automatically. This is how the ERA settlement process also handled in our finance and operation system. Now, next is other process integration, because there are some optional the process which you have in your clinic, or it can be in the hospital, like doctor's commission. Maybe it is not your permanent employee, but as per the revenue generated, you need to give a commission to the doctor. So what are those details you want to do? Because as per the every bill, we are able to capture what is the treatment provided by the doctor or any referral doctor. All the details have been captured in our operational system, and it has sent to the finance and operation system. And if we set a slab of this doctor, of this treatment, or any particular services, this much commission slab, all these parameters, if we can define, automatically we can able to accrue the commission which is payable to the doctor at the month end. We can disperse this commission to the doctors. So this is how we can able to handle the doctor's commission into the ERP system. Referral commission, obviously, if you are getting the referral doctor from any other clients or any other hospitals, if we are dealing with the referral commissions, the same concept is also applicable for the referral commission as well. So overall, if you can see the whole HA system, whatever the operations which is handling, and how the total financials has to be recorded for our management reporting and controls and validations. If our system, of our ERP back office finance and operation system, if it validates the data and it can able to trace or suggest you the errors which has happened in the operational system, so it can able to validate your complete process as well as your financials, and it will help you to provide you an accurate financials into the finance and operation system. So this is how it automatically talk each other, and the operations will be seamless. So this is what about the HA system and your all the pharma distribution challenges which we would like to share with you all.